Okay, good question. When is exercise good or bad for your neck or your lower back? There's this concept called centralization, peripheralization. Fancy words, but it gives us a lot of good information on whether an exercise is good for a patient or bad for a patient when we're talking especially about lower back pain or sciatica. Okay, so let's go over what that means. Okay, so I'm going to show you my horrible drawing. All right, so this is our lower back. Okay. These are our knees. Okay. This is where our spine is, right here. Okay. So when we're talking about pain, let's say we have lower back pain right now. We have pain right here in our lower back. Let's pretend that pain starts moving down our leg, okay, into our toes. Okay, it's down here. That's typically a bad sign. If the pain is originating, let's say we start doing a particular movement, like we move our back like this a few times, and we have pain at our knee, and going from our buttock, from our spine, to our buttock, to our knee. If the pain starts moving away, like I start flexing forward, let's say I'm reaching, I'm picking up some boxes. As I'm doing that, if I'm flexing forward and the pain starts radiating further down, it may not be an exercise, but it's definitely a movement that we consider not good at that time. All right? Let's say we start with the pain now in our ankle. We start doing a motion this way, or we do a side motion, and the pain starts moving up. Now, instead of it being in our ankle, it's actually up by our knee, our buttock, or our back. That's considered a positive sign. So when pain is moving up the leg or into the back, it's considered centralization. When it's moving down and it's going down, now this could be an exercise or an activity. If you're sitting too long in the car, sometimes people start noticing they're getting more symptoms further down. If they're getting symptoms and it's actually moving up, that could be pain, tingling, sharp pain, numbness. Whatever direction, going up towards where we think the origin is in the lower back, that's considered a better sign. That's a good sign. It's called centralization. But if we start doing something with, let's say we start with lower back pain, we start getting pain radiating further down, that's a bad sign. Okay, in 99.9% of the cases. I'm sure there's exceptions. There are people that have knee issues or hip issues. Actually, let me restate that. They have back or hip issues. Those people, sometimes you can have them coexist. Like I would say some of the people that are a little older that have hip arthritis and also, let's say, lower back degenerative joint problems or degenerative disc problems, they sometimes have problems with both the back and the hip giving them trouble at the same time. So they can be a little confusing. They could be doing a movement that appears to be helping one thing, but it's not changing their hip. Let's say they have hip pain, but the exercise we're doing is affecting their back, but it's not changing their hip pain. So we actually think the exercise is not good for them. But that combination does exist. And when you do have decreased motion at the hip or problems in the hip, it can cause some problems for the spine. It's almost like since one isn't doing their job, it creates more problems for the neighbors. You can have more problems for your knee. We're kind of going into a little different topic here, but why not? So this is our knee, this is our hip, this is our spine. Okay. If we have loss of motion or problems at the hip, it can cause some problems for our spine and our knee. Vice versa, if we have knee issues, it can compound some problems up here. Let's give a couple examples. I just thought about this, and I had a canceled patient. I figured I'd talk about it. We have a patient that's got a lot of problems with their knees. So one of the compensations to avoid movement at the knee is actually they'll try and not bend their knees and move forward. So they go forward repetitively like this. And most patients, even if they've never had back issues, they'll say, oh yeah, I got to bend at the knees to prevent my back from bothering me. So sometimes our knee issue can compound our hip and spine. Those areas of I call it above the problem or below the problem, cause some trouble. Sometimes we can't squat. We talked about this in a previous video. because our ankle's giving us trouble. So when we try and squat down, the lack of ankle mobility here actually creates problems at the knee and hip. We have to change the way we move because the problem's above and below. So the reason why I say this, I figured I'm kind of going into a couple different topics, but the first topic was the movement of pain. But realize in spine and knee and hip and ankle issues, sometimes problems that are occurring at the knee are being created above and below the joints we're talking about. When we talk about the spine, the hip, lack of hip mobility can actually put more pressure into the spine or the knee. So just a couple of different concepts we talked about. The first one was the movement of pain when we're doing a movement from spine and neck issues especially. This doesn't apply to the knees and hips as far as centralization, peripheralization. But when you have a movement and it's moving away from where we think the origin of the problem is, okay, moving away, just remember that's peripheralization, okay? I'll just call it periph. Centralization, I'm just going to shorten it, is moving towards where we think the problems. Peripheralization is moving away from where the problems are and further down the leg. One of the examples of peripheralization can also be when we think about a person that has a heart attack. They're actually getting arm pain. Think about that. We have a heart issue and we're getting pain radiating down the arm into the jaw away from the site of injury. It just doesn't happen in orthopedics. It happens in other areas. Different organ problems can sometimes give you back pain when it's not actually the origin. So sometimes the location of where we have problems isn't actually the side of the problem. So anyway, the main takeaway today is the centralization and peripheralization. I had a couple moments I figured I'd talk about it. And we also got into a topic which sometimes I'll talk about, is how the problem is actually often when you have a knee issue or an ankle issue, sometimes those problems can cause problems above or below the joint we're talking about or the area that we're talking about. A couple little walkaways today, just a little couple tips I hope it helped you out. All right, have a great day.